Hi, my name is Greg Felt. I'm Director of Public Health in Sheffield. This is a situation report as of today, 5th of July. Are still above 1, probably 1.3, 1.4. Rates have gone exponential in the last couple of weeks. They're going up very steeply now. 7-day rates well over 200 per 100,000, a bit below the Yorkshire average, but not much. Almost all in 15 to 35s. There's a little bit in older adults. Interestingly, not much in primary school age children. So most of the cases are in 15 to 35s, 15 to 40-year-olds. You can still be poorly. The theory goes that younger adults are not poorly. You can still be poorly. There isn't much hospitalisation. The link between case rate and hospitalisation and death is broken, and no signs of that being refixed. You still need to isolate, and this is the case rates have gone up, is having a significant impact on our ability to run services. I know this is an issue in the NHS, I know this is an issue in schools, both teachers and pupils being off, and I know it's an interesting issue in hospitality sector where most of the employees are about 15 to 35. So there are places that are closed because staff are off, they're poorly, they're at home, they're isolating. So we still need to make sure that we limit the spread of the infection. We're trying to reopen the city at the same time. So for those reasons, running businesses, running services, limiting spread does remain important. Yes, of course, we want to open up. I think it's very likely that the roadmap will stick beyond the 19th of July, but we still need to limit spread. We need to run services still. So, and of course, long COVID is an ever-present concern, still imprecisely characterised, but it's an issue, and so we want to avoid it if at all possible. Limiting spread, you know the drill, same old, same old. If you have symptoms, get a test, stay at home and isolate. The single most important thing you can do. Washing hands, face coverings, space and distance between people, air, ventilation, all important and have made a difference. And vaccination is the thing that's really, really made a difference, and we will continue to vaccinate, offer a vaccination to anyone over the age of 18. Significant number of people who are eligible haven't taken up the offer yet. I'd encourage you to do so really quickly, and if you've had dose 1 and not had dose 2, it's really, really important that you get dose 2 because you're fully protected after dose 2. So we've heard the great news last week that Tramlines is confirmed to go ahead. Once again, like we did with the World Snooker Championships, the Council and Sheffield is playing a significant part in the government's events research programme. Helping events to be staged safely is clearly an important part of our return to normality and normal life. We are working closely with the Department of Culture, Media and Sport and Government and Tramlines organisers to support the event. My advice in advance of the milestone event, and it's a significant event for Sheffield, if you're a ticket holder, take the opportunity to get your vaccine. One of the entry criteria will be double vaccinated, and it's important that you do so. So there are lots of options if you're aged 18 and over, booking on the National Booking Service or go along to one of the many pop-up clinics that are operating across the city. More information is on our website. I said last week, and I'll say again, there are lots of people not returning for their second dose. You're not fully protected after one dose. You do need both doses to be fully protected. If you have to cancel for any reason, then please rebook. It's really, really easy to rebook. The Delta variant is now responsible for all of our cases in Sheffield, and we need to make sure that we protect as many people as possible, especially the vulnerable. So if you're due for your second dose, please don't hesitate to book it or walk into one of the many pop-ups. Finally, on Tramlines, it's an events research programme. It is research, and it's really important that you participate in that research and consent to be a part. The entry criteria will be a negative lateral flow device test 48 hours in advance, or double vaccine plus 14 days. So if you want to get in, you want to make sure that you can get in, get double vaccinated. And if you've most importantly, if you've had symptoms or you have symptoms, then stay at home and you'll be offered a refund.